This wee video is on the rebirth of psychedelic science, but before we get into all that, I'm going to take you back to where it all began. In 1943, Dr. Albert Hofmann accidentally discovered the psychoactive properties of LSD when he accidentally got some on his fingertips. He then went on a bicycle ride and experienced the first acid trip. A decade later, scientists began to realise the benefits LSD could bring in conjunction with psychotherapy. Patients were given a dose of LSD alongside therapy to aid a variety of mental health issues. Mainly, it was used for alcohol and narcotic abuse. It was also used to help with anxiety disorders and even in aiding terminally ill cancer patients, finding that the drug helped them to come to terms with their fate. Results from these studies were extremely promising, of people often having highly positive and insightful experiences with little adverse effects in patients and extremely low addiction potential. The drugs then slipped into the mainstream. In America, the Vietnam War was in full swing and many began to question the authorities. Spiritual awakenings, rejection of leadership, slogans such as "Drop acid, not bombs" became a staple in the hippie movement, and a government intervention took place in the form of a massive smear campaign. A drug back then needed good reason to be banned. The publishing of ridiculous newspaper headlines for some fried reason counted as evidence that the public were concerned, and psychedelics were banned in America in 1967. The most devastating year for psychedelic science was 1971, during Nixon's scaremongering campaign, where he declared a war on drugs.
Fundamentally, it is essential for the American people to be alerted to this danger, to recognize that it is a danger that will not pass with the passing of the war in Vietnam, which has brought to our attention the fact that a number of young Americans have become addicts as they serve abroad, whether in Vietnam or Europe or other places. Because the problem existed before we became involved in Vietnam, it will continue to exist afterwards.
So anyway, this absolute Egypt got the very things which were helping addicts banned in America in 1967. And legislation was then passed in the United Nations banning the use of psychedelics across the world. This was disastrous for psychedelic science, and psychedelic-assisted therapy was made virtually impossible. Psychedelics were then considered Schedule 1 and still are 50 years later. Funnily enough, part of the requirements for being Schedule 1 are that the drugs are considered to have no medicinal value and high potential for abuse. Evidence for the benefits of the drugs alongside therapy was astronomical, but that's politics for you. This wee legend here is Professor David Nutt, one of the researchers and activists at the forefront of psychedelic research. Think of him as like the David Attenborough of drug science. Well, he considered what happened to be the worst censorship of research in the history of the world, prohibiting the use of psychedelics in 240 countries. So many more people could have been treated, and so much more neuroscience could have happened in the last 50 years if this didn't happen. Now, regulators would argue that they just banned it for recreational use, not for research, but in reality, that's what they did. From the early 50s to the late 60s, when it was first made available, there was a massive amount of research produced, with the United States government funding over 130 separate grants for psychedelic research. When the 1971 ban hit, people still had data to publish, so there was a wee period where there were some publications, and then it gradually started frittering away. Firstly, the United States government never funded another study, and the rules to access psychedelics became so oppressive that it essentially blocked those who wanted to do such research. Therefore, just a handful of studies were done from 1970 to 2010. However, some trailblazing scientists were having absolutely none of it and started to fight back. At the forefront of this was the Beckley Foundation, which pioneers psychedelic research to drive evidence-based drug policy reform. Alongside researchers within the Imperial College of London, they began doing research which resurrected psychedelic science, initiating a psychedelics renaissance. Together, they did the first systematic brain imaging study with psychedelics, the results of which showed that under psychedelics, the brain becomes much more connected. On the left-hand side, you can see the brain under normal conditions, with most of the connectivity around the edge in what's known as a small world brain, where peripheral parts talk to each other. communication does occur across submodules, but most of the processing in the brain is done locally, in different brain regions. Under psychedelics, however, this opens up connectivity in the brain. That is perhaps the reason why psychedelics allow people to see things differently, allowing them to tap into memories they've repressed and come up with solutions to problems they'd failed to solve previously. I'll go into the leading theories behind how it does so in the brain in a future video. Thankfully, this study, among other insights from studies across the world, paved the way for clinical trials involving psychedelic-assisted therapy to re-begin. The usual suspects in psychedelics, and in some cases MDMA and ketamine, have been used in treating patients with treatment-resistant depression, addiction issues, those suffering from post-traumatic stress disorder, and in terminally ill people, helping them to come to grips with their end-of-life anxiety. In my next few videos, I'll delve a wee bit deeper into these studies. Thanks for watching, and if you're interested in finding out more, don't forget to subscribe.